the main way that StemWave is different from laser technology, I think the best way to answer this is to explain just what we hear directly from our customers. So of the offices, the over 500 offices that we work with, about 40% of them actually have laser technology prior to adding StemWave to their office. And so I could dive into like the deep cellular differences that are going on, but I'll tell you the main things that we hear and just how it affects the day-to-day of the clinic. The first thing that we hear with laser technology, just in terms of how it's different, is the diagnostic capabilities that the technology has. So if you run laser over an area of concern within a patient, you're not going to get any feedback, which it makes it pretty complicated for you to know if you're addressing the exact right area. Whereas with StemWave, when you run it over the area of concern, as soon as you hit the damaged tissue or inflammation, you get immediate feedback from the patient. So that totally changes the dynamic of how accurate the treatment is getting. Now, the second thing that we see is when you use laser, it oftentimes takes 5, 10, and you know this if you have a laser, 5, 10, 15, visits to get some serious improvement for the patient. This makes it really, really tough for patient compliance because if the patient's not bought in, their likelihood of converting into care is extremely low. Whereas with StemWave, we expect anywhere from 10 to 30% improvement on that first visit, which changes the game just in terms of the number of patients you can process into care. And with StemWave, you can expect linear improvements every single visit, which again, it just helps tremendously with patient compliance. So the end result of those two things though, is that number one, you have a patient who's a lot more bought into the idea of a treatment because they saw results early on. Number two, you have a provider who's very confident in their treatment because they're getting improvements every session. And then the end result of all of that is the provider can often charge a bit more for doing that. So what we see is laser clinics or clinics who use laser, they're charging anywhere from $40 to $80 per session. Whereas with StemWave, you're charging generally a minimum of $100 per session, maximum of $200, $250 per session. So much better return on time. The treatments are much quicker. And most importantly, it's just a lot smoother for the patient to get the desired result.